A seizure patient develops difficulty clearing secretions after convulsion. What should the nurse anticipate? A. Use of suction to maintain airway. B. Allow spontaneous clearing only. C. Avoid airway management. D. Encourage swallowing immediately. Correct answer: A. Use of suction to maintain airway. Post-ictal secretions may obstruct the airway. Suctioning maintains airway patency and prevents aspiration. A patient suddenly falls to the ground, stiffens, and begins to jerk uncontrollably. What is the nurse's priority? A. Insert a padded tongue depressor. B. Protect the patient from injury. C. Restrain limb movement. D. Call the physician immediately. Correct answer: B. Protect the patient from injury. Safety is the top priority. Move harmful objects and cushion the head. Never force objects into the mouth. After a tonic-clonic seizure, the patient remains unconscious and has labored breathing. What is the most appropriate nursing action? A. Place the patient in a side-lying position. B. Keep the patient flat on their back. C. Sit the patient upright. D. Insert oral airway forcefully. Correct answer: A. Place the patient in a side-lying position. This position maintains airway patency and allows drainage of saliva or vomitus, preventing aspiration. A patient with epilepsy reports tingling in the right hand, followed by stiffening of the arm. The nurse recognizes this as A. Complex partial seizure. B. Jacksonian seizure. C. Absent seizure. D. Myoclonic seizure. Correct answer: B. Jacksonian seizure. Jacksonian seizures begin in one area, typically an extremity, and may spread progressively. The nurse observes a patient staring blankly and blinking rapidly for 5 seconds, then resuming activity as if nothing happened. The nurse should document this as A. Tonic-clonic seizure. B. Myoclonic seizure. C. Absent seizure. D. Focal seizure. Correct answer: C. Absent seizure. Absent seizures cause brief lapses in awareness with no post-ictal confusion, common in children. A patient with epilepsy has recurrent seizures despite medication. What diagnostic test should the nurse expect to identify abnormal brain electrical activity? A. Electroencephalogram. B. Magnetic resonance imaging. C. Skull X-ray. D. Angiogram. Correct answer: A. Electroencephalogram. An electroencephalogram detects abnormal neuronal discharges responsible for seizures. The nurse is caring for a patient with epilepsy who develops continuous seizures without regaining consciousness. What is the nurse's immediate action? A. Document the seizure type. B. Place the patient in a chair. C. Start oral anticonvulsant. D. Maintain airway and administer oxygen. Correct answer: D. Maintain airway and administer oxygen. Status epilepticus is life-threatening. The nurse must secure airway, oxygenation, and IV access immediately. A patient experiencing status epilepticus has IV access established. What medication should the nurse anticipate administering first? A. Diazepam. B. Oral phenytoin. C. Aspirin. D. Morphine. Correct answer: A. Diazepam. IV benzodiazepams like diazepam are the drug of choice to rapidly stop continuous seizures. A nurse observes a patient making lip-smacking movements and wandering aimlessly during a seizure. Which seizure type is this? A. Myoclonic seizure. B. Absent seizure. C. Complex partial seizure. D. Jacksonian seizure. Correct answer: C. Complex partial seizure. Complex partial seizures involve altered consciousness and automatic, purposeless behaviors. A patient with epilepsy is scheduled for MRI. The nurse explains that the test helps to A. Record brain waves. B. Identify structural brain abnormalities. C. Detect electrolyte imbalance. D. Diagnose infections. Correct answer: B. Identify structural brain abnormalities. MRI reveals lesions or tumors causing seizures. The nurse caring for a patient post-seizure notes incontinence. What is the appropriate response? A. Provide privacy and hygiene care. B. Reprimand the patient for lack of control. C. Ignore the episode. D. Delay cleaning until patient is awake. Correct answer: A. Provide privacy and hygiene care. Respect and dignity should be maintained while ensuring comfort. The nurse notices a patient becomes cyanotic during the tonic phase of a seizure. What should the nurse's first action? A. Insert airway. B. Loosen tight clothing around the neck. C. Give rescue breathing immediately. D. Restrain patient's arms. Correct answer? B. Loosen tight clothing around the neck. This reduces airway obstruction and improves ventilation without restraining movement. The nurse finds a seizure patient lying on the floor after a convulsion. What is the best immediate action? A. Check for breathing and injuries. B. Move the patient abruptly to bed. C. Call family members. D. Offer food or drink. Correct answer? A. Check for breathing and injuries. After seizure activity, airway and safety assessment are priority. The nurse instructs a patient with a seizure disorder to avoid alcohol and caffeine. What is the rationale for this teaching? A. They reduce drug metabolism. B. They lower the seizure threshold. C. They prevent medication absorption. D. They cause hypertension. Correct answer? B. They lower seizure threshold. Alcohol and caffeine increase neuronal excitability and trigger seizures. A patient who has undergone a temporal lobectomy for seizure management asks about the purpose of the surgery. What is the nurse's best response? A. To stop brain bleeding. B. To control infections. C. To remove the seizure focus area. D. To improve memory. Correct answer? C. To remove the seizure focus area. Temporal lobectomy removes localized areas generating seizures. A nurse observes a patient having short, sudden jerks of the arms upon waking. This type of seizure is A. Absence. B. Focal. C. Tonic-clonic. D. Myoclonic. Correct answer? D. Myoclonic. Myoclonic seizures often occur in the morning with brief muscle jerks. A nurse is teaching a patient with epilepsy about triggers. Which statement indicates correct understanding? A. I can safely use flashing light devices. B. I can consume large amounts of caffeine. C. I should skip meals to lose weight. D. I should avoid sleep deprivation. Correct answer? D. I should avoid sleep deprivation. Fatigue and lack of sleep can provoke seizures. During admission, a patient with epilepsy states they feel embarrassed about their condition. What is the best nursing diagnosis? A. Ineffective coping related to psychosocial effects. B. Impaired physical mobility. C. Risk for infection. D. Knowledge deficit related to medication use. Correct answer? A. Ineffective coping related to psychosocial effects. Stigma and anxiety about seizures may affect emotional adaptation. A patient with epilepsy is on long-term phenytoin therapy. Which statement indicates the need for further teaching? A. I take my medication daily as prescribed. B. I stop my medication if I feel well. C. I visit my dentist regularly. D. I report any rash immediately. Correct answer? B. I stop my medication if I feel well. Abrupt withdrawal of anticonvulsants can precipitate status epilepticus. A patient with epilepsy is febrile. What should the nurse do first? A. Encourage exercise. B. Withhold antipyretics. C. Document temperature only. D. Treat the fever immediately. Correct answer? D. Treat the fever immediately. Fever can trigger seizures. Early intervention is necessary. A patient's seizure begins as arm twitching, then spreads to involve the entire body. This represents A. Secondary generalized seizure. B. Absent seizure. C. Complex partial seizure. D. Myoclonic seizure. Correct answer? A. Secondary generalized seizure. The seizure starts focally and generalizes to both hemispheres. A patient experiences a seizure triggered by flashing lights during a concert. This is best explained as A. Febrile seizure. B. Reflex seizure due to sensory stimulation. C. Complex partial seizure. D. Post-ictal seizure. Correct answer? B. Reflex seizure due to sensory stimulation. Bright lights or loud sounds can trigger seizures in photosensitive individuals. The nurse notes that a patient developed a seizure after sudden alcohol withdrawal. This seizure is most likely due to A. Metabolic imbalance. B. Genetic factors. C. Drug withdrawal. D. Infection. Correct answer? C. Drug withdrawal. Alcohol withdrawal can trigger hyperexcitable neuronal activity leading to seizures. During a seizure, a nurse accidentally holds the patient's arms tightly. What is the potential consequence? A. Reduced convulsion. B. Fracture or injury. C. Improved airway. D. Faster recovery. Correct answer? B. Fracture or injury. Restraining may cause musculoskeletal injury. Movements should be gently guided only. When preparing a patient with epilepsy for an electroencephalogram, the nurse should A. Instruct the patient to avoid caffeine. B. Keep the patient fasting. C. Allow the patient to consume alcohol. D. Withhold sleep before the test. Correct answer? A. Instruct the patient to avoid caffeine. Caffeine alters brain electrical activity and can interfere with electroencephalogram results. A patient with a seizure disorder reports fatigue and dizziness after starting phenobarbital. The nurse recognizes this as A. Expected sedative effect. B. Allergic reaction. C. Toxicity. D. Withdrawal symptom. Correct answer A. Expected sedative effect. Phenobarbital causes central nervous system depression. Safety precautions should be advised. The nurse should question which order for a patient with epilepsy. A. Phenytoin 100 mg TID. B. Alcohol as a sleep aid. C. Regular electroencephalogram follow-up. D. Balanced diet. Correct answer B. Alcohol as a sleep aid. Alcohol lowers seizure threshold and interacts with anticonvulsants. A patient in the emergency department is actively seizing. What is the nurse's first action? A. Ensure a patent airway. B. Establish IV access. C. Administer anticonvulsant. D. Obtain seizure history. Correct answer A. Ensure a patent airway. Airway and breathing are always the first priorities in active seizures. The nurse caring for a seizure patient notes confusion and headache after an episode. This represents which phase? A. Pre-ictal. B. Ictal. C. Post-ictal. D. Aura. Correct answer C. Post-ictal. Post-ictal phase follows seizure activity and includes confusion, fatigue, and headache. A patient with epilepsy reports aura of flashing lights before seizures. The nurse should interpret this as A. Hallucination. B. Early warning of seizure onset. C. Drug reaction. D. Visual impairment. Correct answer B. Early warning of seizure onset. Auras often precede focal seizures and signal onset. Great job making it to the end of Epilepsy NCLEX questions and answers. How many questions did you get correctly? Drop your score in the comments section below. I'd love to see how you did. Make sure to subscribe and turn on the bell notification to get notified when we drop our next video.